Are you ready for today's show? We have a bonus talk, and I found Lourie again. She also joined this talk, and I have Liz Meyers. So I thought, why not? Let's talk about the PTSD and women health. So be with us till the end. We're gonna have some freebies and some great topics. I'm very excited today because, again, PTSD Compass book is up, and on the top categories, it's doing very, very good. Number one bestseller on US, Canada, and today I just realized I'm doing good on Australia without any promotion, anything. And one of my friends said, "Why don't you do the promotion there?" I said, "Oh, just I'm going to think about it." So for all of you that are here and joining us, just want to let you know that we have a very amazing book, PTSD Compass, from 14 speakers, including 5 authors as well. So we have different chapters for authors, and we talk about different modalities in PTSD. How to recover from grief, how to recover from domestic violence and abusive relationship, childhood trauma, and also the one I really love was about the mind and body connection. And today we're going to continue mind body connection because I know exactly how it works for me, at least, about the miscarriage and the women health. Here, Dr. Lourie is a naturopath. I want them first to introduce themselves in 1-2 sentences, and then we go through the talk together. All right, I'm going to start with Carol.
Sure. Hello, everyone. I'm so honored and happy to be here. I'm Lourie. I am a naturopath, acupuncturist, homeopath, and the focus of my practice, as Pantia mentioned, is mind-body health. And I focus that on helping women transform from chronic illness and disease, such as autoimmune, thyroiditis, trauma, and especially breast cancer.
Carol, can you check your voice? Yeah, maybe if you go further, much better.
There we go. That should be better, right?
Yeah.
Okay, sorry.
Okay, no worries. Elizabet Meyers. This is the first time I had her, and one of my good friend actually introduced her to me. She's 2 times bestseller author and podcaster, and I'm really honored to have her here. Welcome to my show.
Thank you for having me. I'm so excited to come and to share today what I've learned. I hope it will be a benefit to your listeners. As you said, my name is Liz Meyers. I'm an author and a podcaster. I'm a homeschooling mother of 8, and my husband is a former fighter pilot. He just recently retired from the Air Force. And so we're living out in East Texas now with all kinds of animals and adventures going. I'm wanting to share today about an experience I had in the past with women's health that led to PTSD and the trauma that I experienced and how I've come through that.
All right, so we're gonna go through our talk, starting with Carol. I just want to know, because she's a homeopath, she's a functional medicine practitioner, and she's a naturopath doctor and acupuncturist, which is the whole thing in one package. And the one thing I love about her is just not about the diagnosis. She go through the PTSD, she go through all the emotional traumas and every layers that a person should have, especially for women who are struggling with different chronic disease and miscarriage or breast cancer. She's an advocate for breast cancer as well. Okay, first tell us, as you are experiencing all of these modalities, why do you go to emotional and stress level first, and why PTSD is so important to look at when you go through the overall health?
Emotional trauma or upset, no matter if it happened yesterday or 5 years ago or 25 years ago, is the foundation for all, is one of the foundation contributing factors for all illness. And um, I have women in my practice who've seen many, many other practitioners and they still haven't recovered their health. And the difference is, in my opinion, is that we haven't focused enough on the moment of the trauma. And as my skill set as a homeopath allows me to prescribe a remedy which can really lessen that traumatic experience, because what we can't handle emotionally in the moment, we take a breath, and that energy, whatever it is, fear, shame, guilt, whatever, gets put into our cells and it lies dormant until there's stress or another upsetting experience. And then all of a sudden, you have an inflammatory illness, you have infertility, whatever it is, you have breast cancer, it pops up. And it's important to understand that I'm not saying you are to blame or there's a cause and effect. There are many contributing factors for chronic illness. And one of the components of PTSD is that it's a fear event that you have no control over. So, one of the healing aspects of this work is that in going back, we get to see how you didn't have control then, but you have a lot of control now. And that is very healing for women across the board, no matter what the illness is.
Exactly, because I know how it works for me. Like, Carol actually recommended me a very professional homeopath because she lives in Toronto, Carol Jones, same name.
Right, I
And
know.
that was my first time actually going through homeopath and just learned that, first of all, it's not for everyone. Because if you can't communicate with your inner trauma and emotional trauma, you cannot talk about it. So you have to express your emotion and PTSD yourself. What is your problem? And Carol went through all of these events that I had in my life. And I love that. But as I said, unfortunately, for some women, it's not easy to uncover their emotional stress. That's why they don't go to integrated medicine, and they don't open. They are not open to about their status with them. So when
Mhm.
you ask them, like, what's your relationship with your husband, or are you happy with your life? These are different questions. It's not easy. You can't talk about this with anybody. So that's why you have to be open first when you start homeopathy or any integrative medicine, and trust your doctor and talk to her, because this is it. If you don't resolve those traumas, you can't clear them, right?
Correct. Correct. You have to be open to the process. You don't have to be totally open to the whole thing, because if someone has had an event, they're closed off to it. That's an indication of a homeopathic remedy. So I don't want people to get the impression that, oh, I can't see a homeopath because I'm not totally open. Homeopathy has the ability to come in to where you are and help you with wherever you are. But if you're open, that's one type of remedy. But if you're closed off, which is reasonable, it happens. People become traumatized, they close off themselves to the grief or whatever. There's homeopathic remedies for that also. So I just want to make
Oh,
sure that people understand that.
yeah. What I love about these shows is that we bring everybody from integrative background, people who work with holistic medicine, and we just want to introduce it to others, that there are other remedies, and you can't replace them sometimes, but it's good to work with your doctors or create a connection between mind and body, right? So
Absolutely.
yeah. So Elizabeth, tell me about your event. I'm not talking about it right now. I know what you've been there, and how did you recover from that event?
What you ladies are sharing is really resonating with me because that's exactly what I experienced. As long as I tried to hide the struggle and the pain that I was dealing with, that was too overwhelming for me to know what to do with, I continued in this downward spiral. It wasn't until I was willing to face it and say, I need to deal with this thing that happened in my past, that I was able to move past that, move through it, and into the next area of life that opened up. As I mentioned earlier, we have a big family. We have a lot of kids, and unfortunately, my sixth pregnancy, my son passed away in the second trimester, and it was very abrupt, very sudden, unexpected. We were visiting with a family for a vacation for an extended weekend, and I had some cramping and minor spotting in the night. I told my husband the next morning what I had been experiencing, and he put his hand on my belly and he prayed for our child. And the last thing he said was, Lord, we surrender this child's life to you. And at that moment, my water broke, and my son's little tiny body was born. He was perfect, but just incredibly small. I held him in the palm of my hand, and it was just so unexpected. And so, I mean, anytime you lose a child, it's traumatic, but just the way everything happened, I really got stuck in that place. And so I wasn't ever like officially diagnosed with PTSD, but I did exhibit a lot of the symptoms of that. I was stuck in that moment, always reliving that experience. That I spent more time stuck in that past moment than I did, cognitively in my present. I still had 5 young children that I was homeschooling and caring for. And, I would drive somewhere, take them to an event, and I get there and realize I had no recollection of how I got there. And then the realization that I was driving and not fully aware of the present was startling and was scary to me. And I didn't know how to process all of this. And it went on for years, for like 5 years. I just struggled with this depression, and I didn't know how to fix it. A week after I lost my son, I hemorrhaged a lot. I lost a lot of blood. I was very anemic, and I never really fully physically recovered from that. So I didn't know what the root cause was. Am I struggling from something physical and that's making me feel depressed? Or am I depressed and that's why I'm exhausted? Or is all of this a spiritual problem because I'm angry at God because he took my baby from me and I can't reconcile that and I don't know what to do with this feeling? And so I eventually, I got to the point where the pain of staying as I was greater than the pain of making a change. And I confessed to my husband first. I'm like, something is wrong and I need help. I need real, like, professional help. And he agreed and totally supported me. And so I just tried to make progress on each of these 4 areas: physically, spiritually, mentally, and emotionally. And I just took the next best baby step that I could in each of those. And there was no dramatic moment when everything turned around, but over time, I got stronger in each of these areas, and I saw how these things are all integrated. And I sought the help of various kinds of experts, professional people, of doctors. I went to a Christian counselor that really helped me work through that trauma. Taking things like natural supplements, even taking medications. And there was all these things that were integrated together to help me get to a place where I was able to process that pain of the past so that I could move through that and move forward. And so now that is what I write and teach and speak about, is just how the mind and the body and the spirit, everything is all integrated, and we can't exclude one or neglect one and expect to be strong in all areas. That these things do all relate to each other, and that we can intentionally build up our resilience to these things. It's not just either you're born with the power to persevere or you're not. It's a learned skill that we all have the ability to teach ourselves.
So what was exactly your solution? So what are the steps exactly you did? I just want to know, did you use any integrative medicine or functional medicine or any of this?
Yes, and it's been a long journey, and like I say, I've tried different things. But I went to my pastor. You know, I asked for prayer from him and his wife. I got their support. I started my quiet time with God again in the mornings. I went for mental health, professional help. I went to see a number of different professional counselors. And as with doctors, sometimes it's kind of a trial and error thing. Like you can't always find the person that will work with you, best, first of all. I've also been to a chiropractor who was into functional medicine and worked with diet and, with all these different things. And I learned through things that I was studying how we have more neurological things going on in our gut area than we actually do in our peripheral nervous system or in our spinal cord. There's more neurons in there. That's why they call the gut kind of the second brain. And so what we eat in our gut health and all, that affects tremendously these chronic illnesses like Carol was discussing. It affects our mental well-being, our emotional well-being. They're all so tightly related, and they each affect another. So our struggles in mental health can manifest themselves in physical pains, aches and pains that we may not realize have anything to do with our past hurt, but they do. And vice versa. We can have physical things that create mental issues and emotional problems for us. And so we need to kind of attack our problems on all these areas and not assume that something is unrelated.
I love the real experience of the one you had with your gut and with your brain. I think, yes, they are really close to each other. I know Carol has some points of it as well. So you go through gut, right? For your patients as well first, right?
I just want to acknowledge the trauma that you had, and that unfortunately your experience is too common. In my practice, if somebody comes to me at the beginning of what happened to you, there's homeopathic remedies that I would have given you that really help reduce the physiological and emotional experience of the trauma. And then when you're horribly anemic, there's no energy for your brain and your body. So that's why it's, the mind body connection comes in. So as an acupuncturist, and an herbalist, I would be giving you herbs to build your blood, as well as homeopathy to address the trauma and the grief and the post-traumatic stress. What you experienced and the commitment that you had to recover and going through different doctors is what it takes, unfortunately. And our standard medical system doesn't cover necessarily the person that you need to help guide you on your healing journey, and then you need to pay for it out of your pocket. And that's a whole nother conversation about what people think they can and cannot afford. So I want to just really give you a lot of support and acknowledgement for being diligent on your journey, and the fact that you have, your spiritual connection to religion is very helpful. In addition to the homeopathy, the acupuncture, the Chinese medicine, the herbs, the functional medicine, the supplements, I think that is very helpful no matter what the illness is. So what was the other question? I just got on a tangent there.
No, you already answered my question. So I was going to ask you that what did you do with your patient if they come with the same situation?
Yeah, I've seen many women just exactly where you were, where they had a spontaneous miscarriage and they lost their baby. And the sooner that we can get in to help with homeopathy and acupuncture and herbs and recover from the anemia, the easier the journey back is. And I have women in my practice 10 years later who come to see me, and they are extremely debilitated still. So from fertility loss and also from breast cancer, side effects from treatment. So 10 years later, they're still really suffering. And the good news is that with the right practitioner, the right combination of modalities, it is absolutely possible to recover your health. It takes a while. And unlike the messaging we get from American advertising, it's not just about taking a pill and all of a sudden you're serving the family the picnic lunch because you were depressed. This is an ad on TV. The woman's depressed, she takes a pill, and the next thing she's serving the family a picnic lunch. The messaging in that is very alarming for me as a feminist. It's like, why is the woman serving the family? Why isn't everybody helping her? And it takes more
Exactly.
than a pill to recover your health. And I know it's an ad, but still. So we need a comprehensive approach, like what you fortunately were able to contribute to yourself. Um, it takes a while, and it's a journey, and it takes focus and determination. And really, the other day I was thinking about the phrase, don't give up, because they say that in the world of breast cancer a lot. I'm a fighter, don't give up. And first of all, I don't think you don't want to be in a relationship with your health where you're fighting with whatever it is. You don't want to fight with depression. You don't want to fight with anxiety. And you definitely don't want to fight with cancer, because those energies, that word creates inflammation. And inflammation is one of the contributing factors for all illness. So we need a more feminine perspective on what it is to recover our illness and listen to the messages of how we got there and what is it that we need to change in our life. So the phrase "don't give up," just when you're thinking that you want to give up, is people understand how difficult that moment is when you just want to give up. I mean, you are not feeling well, you are discouraged, there's physical issues, and, and then your brain goes into overdrive thinking, oh, this is too hard, I'm going to give up. That's a time to reach out for support, because the other aspect of healing is, and which is not in our American advertising world messaging, is that we need community and support. You had that with your church, I'm sure. Women are too isolated in our society. So that's the beauty of, I have a Facebook community where I'm there frequently, and I offer support and the community supports each other. So women have the ability to provide a lot of support, whatever the illness is. It's part of what's needed to recover.
Yes, I like that, like support. And another thing, as you said, I see women with cancer, women with miscarriages, they're still recovering from their problem. And but they are expected to serve the family. And that's the bad point because you are still recovering and you need care yourself. You need a lot of care. Somebody should look at you, somebody serve you food, and then you have to serve things for your family. So I like to talk about breast cancer right now, but let's have like few-second break and we come back again. Please subscribe to Pontal Calhoun Transition channel to get the latest interviews and order my book PTSD Compass through Amazon. How to confront PTSD and navigate trauma to triumph. Okay, Carol, tell me about your work. I know you are seeing different patients with different problems, but right now you are a serious advocate for breast cancer these days. What's the reason behind it? And then let us know about how you do exactly, about your webinar, if you have any support group or help for others.
So when I went to the National College of Naturopathic Medicine, of course, we had several oncology classes, and I learned about integrative or naturopathic approach towards cancer. And it was just like a disease that was out there. And then several years after I graduated, one morning the phone rang and I thought it was a crank call, but it turned out it was my dear friend, and she was hysterical because she had just been diagnosed with breast cancer. They found a lump on her mammogram. And, you have cancer, they found a lump. Those are the 4 words that no one wants to hear or no one is prepared to hear. And in that moment, I committed to going through every aspect of her treatment with her, which was an 18-month journey. And right from the very beginning, I began to employ my skill set as a naturopath, and acupuncturist, and a homeopath to help her reduce the side effects of every aspect of the treatment, the biopsy, and then the chemotherapy and the radiation. And she ended up having to have her uterus removed because she had a adverse effect to tamoxifen, which is not that uncommon. So one day we were in the oncology office at UCSF in San Francisco, and the doctor looked up at her blood work and then looked at us and said, "I don't know what you're doing, but I want all of my patients to be doing that too." Because her blood work was not that of somebody in the middle of chemotherapy. She didn't have anemia. Her white cell count was great. She looked great. She felt well, and she had a really positive attitude. And so the focus of my practice began to be, in addition to fertility, which is really a passion and a love of mine, helping older women become pregnant and or prepare women for IVF, or help women who have the diagnosis of unexplained infertility, which I always find very funny because it's not really funny. It's unfortunate because an unexplained illness means that the right testing wasn't done. And I can go into a little transition for that if you don't mind. I had a 35-year-old woman come to see me with that diagnosis of unexplained infertility. And she had enough perfume on, and I had a scent-free office for like when you go into the ground floor of a department store where the perfume is. And I said to her, "So tell me about you and scents." So she goes, "Oh, I love scents. I have the plug-ins, I have the sticks in the oil, and then this is the cincher for me. I spray my sofa with that that stuff that I won't mention the name of, but it begins with the letter F as in Frank, and I'm spraying my sofa with this." And I said to her, "So when you go home, gather every single body lotion, shampoo, home cleaning product, dishwashing, laundry, everything on the counter and take a photo." 29 items. She didn't have unexplained infertility. She had estrogen overload, dominance, detoxification, blocked pathway problems. Because when you spray your sofa with that product, when you use dryer sheets in your dryer, and this is true for breast cancer or any illness, those chemicals are absorbed into your skin. And those chemicals are what is known as estrogen disruptors. And they keep your healthy estrogen from being properly excreted. And then they create something called estrogen dominance. And then you end up with unhealthy estrogen in your body, which leads to infertility, which leads to PCOS, which leads to breast cancer, which contributes to breast cancer. So 3 months later, she had to throw out her sofa because we couldn't, this is a funny phrase, we couldn't detoxify her sofa. She had to throw out her sofa. I put her on smoothies. She changed her diet. She started taking supplements. She threw out all of those toxic cleaning products and went to eco, natural everything. And of course, she was pregnant naturally without having to spend $40,000 on IVF. And she now has 3 babies. So that's a little, but that protocol and that information also applies to women with breast cancer. I am a very strong advocate for a more feminine approach towards women reclaiming their health. And that's very important and dear to my heart. So with breast cancer, once my friend was diagnosed, I started seeing a lot of women with breast cancer. And having been through that process with my friend, I got an up close and personal experience of what was working in the medical field, which is a lot, and what they don't know about, which is where my skill set comes in. And there's an enormous amount of science-based information for integrative care. Notice I don't say alternative, it's integrative, because you want to take the best of both worlds. And when we use both, we can help a woman go through chemotherapy with less side effects. Her healthy cells can be protected. We can help her recover from the side effects of chemotherapy. And then moving forward for what I call the third phase of the breast cancer journey, we want to prevent recurrence. And that's where I'm focusing my online group practice right now, Empowered Against Recurrence. The whole month of October is Breast Cancer Awareness Month. We're coming to the end of this month. And I launched my Empowered Against Recurrence program to the community at large. There's been thousands of women who have listened to my free class. My next free class is today at 5 p.m. Pacific, 8 p.m. Eastern time. And I see that you are putting the link to register for the free class, which is just wonderful. I hope everyone who's listening, I don't believe it's an accident. Everyone knows someone that has been impacted by breast cancer. It's not an accident that you're here and we're connecting. So if you have a moment and if you register and you can't see it tonight, you'll get a replay link. And my next group class starts next Wednesday morning. And I hope to see you at the webinar. That would be really wonderful for you to be there.
Yeah. First of all, we think that we pray that nobody has breast cancer, but unfortunately some people has it. And some people have it, and we try to help and show you the right guidance here. And now we're gonna get back to Elizabet, if she want to add something powerful for women who are struggling with miscarriage or they lost the baby. um, what what was your inspiration after you recover from that trauma?
Hey, Dr. Carol, thank you so much for what you shared, and I wish that I had met you back then.
It's never too late.
Yeah, I really had a difficulty with some of the medical professionals that I was working with, and I'm not saying everybody is like that, but just I've also had really good experiences with medical professionals, but in this particular case, multiple things. I was out of town when it happened, so I was at a different hospital. Is just ER things. When I walked, but the people there refused to refer to my son as a human child. They would not acknowledge his death because they didn't want to acknowledge his life. He was under 20 weeks. And so by medical definitions, that's not considered human. I'm not making like a political statement here, but I just felt like they were so concerned about another woman's right to choose that they would not permit me my right to grieve the child that
No,
I
I don't
loved
think
and I
it's
wanted.
about. I really want to encourage you not to make it about that. I think that it's not about a woman's right to choose, really. And I don't want to be disrespectful. Everybody has. See, when we get into controversy and they're right or I'm right and they're wrong, we're creating inflammation, and inflammation creates discord. And it doesn't have to be about that.
Yeah.
You have a certain belief, and they're from the medical perspective with their beliefs. It doesn't mean that they're wrong and you're right, or vice versa. I think what we need to concentrate on here is in that moment, you felt that your belief system was being disrespected by the hospital staff in the emergency room. And unfortunately, the emergency room physicians are not trained in sensitive patient management. But it doesn't mean that they have then the right to they should be able to listen to you in that moment about what you preferred. I mean, you were the victim of this horrible trauma, and you had the right to have all of your needs and wishes respected and taken into consideration with sensitivity and dignity. And when you have a miscarriage at 20 weeks, if you feel that your son is there, they should have been able to pay attention to what you're saying and respect that. And I'm sorry that didn't happen to you, but I really don't think it's about their right to choose versus what happened to you. I think that would be creating controversy where we don't need to go. And I'm
not trying to create controversy. My issue was that it wasn't like difference of beliefs. It was they denied his humanity. I mean, he was a perfect little baby. I brought him in. They called him the product of conception, and they did not allow me.
Term. It's a medical term. It's unfortunate. It's a medical term. They weren't allowing you.
I see the different series in Netflix about the medicals. And the good thing, recently they added a psychotherapist inside the medical service. And they go through the emotional states of the patients, and they don't just diagnose the patient with what they have. And that's I think that's what should be added in different hospitals. I'm not sure exactly. In I know in US there are in some hospitals they do it, but I'm not sure exactly if they do it in Canada or if they do it in other countries. I know in some countries they don't have this system. But to me, as you said, miscarriage, chronic pain, or or loss or accident, anything, any trauma, um, after the trauma, you may have physical injuries. And if you don't connect that physical injuries to your emotional states, healing is going to be very difficult.
So
Yeah.
what you were saying, Liz, is that their response to your unfortunate loss of your son contributed to your trauma. And
Yes.
that I'm so sorry that that happened. If they had been able to be more sensitive to your needs and called him your son, that would have been less trauma, but they added to it by their terminology. And that is very unfortunate. I'm very sorry that happened to you.
Yeah, it's like if my child had been killed in a car accident and the first responders and people are like, oh, don't worry about it, that wasn't really a human child anyway. That was kind of the response that I got. And then when I tried to say later, I go back to my original doctors when I'm back home, and I was saying, I am not feeling well, I'm not recovered physically, like something is wrong. And they would do their tests and they'd be like, you're fine, you're not anemic anymore, you're okay, it's all in your head, there's nothing wrong with you.
Well, this is
So
like that woman who came into me with unexplained infertility. They didn't have the skill set to understand what was going on for you. And then that contributed to your trauma on top of what you were having. They weren't able to listen to you. And honey, of course you weren't feeling well after that happened.
yeah,
There's just no way that you could have been
right.
feeling well, right?
But the answer that I got was, you've been through a difficult thing. Give it a year, and if you still don't feel well, then come back to us. So that was kind of what led me to just sort of hide my problem. I hid my depression because I had been told it wasn't right for me to feel that way. I shouldn't feel grief over this child. You get comments from even well-meaning people who just kind of say, "Oh, well, at least you weren't further along," And to me, that was like, well, at least your child wasn't 5. At least she was 3 when she passed away. That doesn't change. That's
No.
just weird to me that people say those kinds of things. And I'm not being angry about that. I'm just saying it was those kinds of misunderstandings that compounded the pain that I was already in. And that's how I got stuck there. When we grieve the loss of someone we love, we have things that we do. We have a memorial service, or there's
Right.
there's things that we have. And unfortunately, when a child dies before they're born, we don't have those kind of things. The
You
hospital
can
wouldn't.
create them. No, but you
Yeah.
can create them for yourself.
Well,
That's important.
yeah. They told me to plant a tree, but we're a military family. I'm like, any tree I plant now, we're going to abandon 6 months later down the road. So it was just really hard to find healing in the midst of all those additional things. So I really like, your approach of, hey, there's more going on here. I mean, even just think hormonally of losing a pregnancy, what that does to a woman physically and mentally and emotionally. I mean, just that one little piece, and there's so much more. So I really agree with you that we need to approach the whole thing holistically, that these things are integrated and that we do need multiple different avenues towards healing. I agree with you 100% that a pill doesn't fix it. But in my mind, the way I had like misinterpreted that was, well, I don't need to have mental health medication, to overcome this. Like prayer alone should be enough or something. But what
No.
my experience is that by taking those pills, yeah, it didn't fix everything, but it got me to the point where I was able to do the other things that I needed to do
I
for
agree.
self-care.
I understand and agree with that.
Yeah, it gave me enough of a bump where I could take these other approaches as well too. And I did try some herbal thing. I didn't have an expert in my life like you that could have guided me more, but I did try some like herbal teas and things that were supposed to be for feminine reproductive health and things like raspberry tea and various things.
Yeah,
like that.
that's too superficial for what you needed. But I think the most important message that I want to share with you and with everyone else listening, and it's no accident that you're listening to this, is that the first thing you need from a practitioner is they need to listen to you. So if a woman comes in and it's been a few months and she after a miscarriage, and it's not just a miscarriage, it's unexpected trauma, and she says, I'm not feeling well, and you look at the blood work and you say, well, you're fine. that doctor is not the doctor for you. If you're not feeling well, the doctor needs to work with you or the practitioner and say, honey, what's going on? Let's look at every little dot and every little cross the T. And of course, you're not feeling well, and validate your feelings and then work systematically to help you. First of all, you need to create some kind of ritual for yourself that you'll be able to bring with you when you move every 6 months, because we haven't mentioned this, but you know, your husband and you and your whole family are serving our country in a very beautiful way. And that is like a huge deal. We're free because of what you and your family and your husband are doing for us. So that puts you in a whole nother category of stress, having to move 5, 6, 8 children, whatever the number is, and your whole household every 6 months is not an easy feat.
Mhm. Yeah,
So
that definitely compounded to it also.
right,
But
right.
I agree with you, and that was my original answer to the original question is, how would you encourage women in this? And I would say the same. Don't give up. When people don't listen to you, or if they don't understand you, or they're not giving you what you need, keep searching, because your health is worth it.
You're worth it. You're worth it.
Yeah.
And don't let somebody disparage you. And the people who say, well, it was only XYZ, they're not in touch with their own trauma and their own femininity. And the only thing you can do is just say, well, they're not, that's I mean, we don't have education in our culture about how to speak to somebody your heart when they've had a traumatic or grieving event. You don't say to somebody, well, thank goodness he wasn't further along. I mean, that is a horrible, insensitive thing to say. All you can say is, I'm so sorry that happened, and how can I help? What can I do to support you in this time? And of course, you don't feel well. So when I said I have women come to see me 10 years later, I'm not exaggerating. It is 10 years later. And thank goodness for you, it wasn't 10 years. But I don't think it's ever too late to have a ritual. I don't know if you did that. I understand that you can't plant a tree, which is a ridiculous thing to say to somebody. But what I would say to you if you were in my office is, how can you and your family create a ritual where you bring something of your son with you wherever you go? And it's never too late to have that.
Mhm.
Maybe all of your children need to draw a picture. Maybe you named him, you want to have his name. I mean, whatever.
Yeah.
It's never too
Yeah, and
late.
we have done different things over the years, in different ways that we've honored his life and remembered him. And of course, my whole book and ministry and everything that I do is because of this time in my life, is how this came about. But my husband just this year retired, so we finally stopped moving, and so I'm now
Thank goodness.
planning the garden. He's going to be, he would have been 15 years old this coming year. And so I'm finally getting to plant plant some things in his memory, but I've waited a long time.
Yeah, you did. 15 years is a long time, but he's right here in your heart all the
Oh, yeah,
time. And he's
definitely.
also in the lives of your other children, all 8 of them, which is such a beautiful thing to have such a huge family. I love that. I only have one child, but I love large families. So that's great.
Yeah, we're very blessed. We enjoy it. So.
Wow,
It's
what a
beautiful
nice
thing.
topic and what a nice conversation. I'm just enjoying it. So we are closing our talk. Just wanna, I love what you said, that don't give up. And then you talk about your own story and how the rituals, family rituals, can help recover from this trauma. Carol, do you want to add another sentence for women who are struggling with chronic health, breast cancer, or miscarriage?
I think Liz said it. Liz's story is, I'm sure there are thousands of women who can resonate this, especially her experience in the emergency room. And as I said earlier, the emergency room physicians are unfortunately not trained in patient sensitivity. I've had many experiences in there with my mom as an elder person, and they do their best. They're trained on the focus of the physical urgency, and they don't pay any attention to the other. And but I don't want to disparage their dedication and to their work either. So I think we all need to have compassion, and it starts with ourselves first. And also acknowledge that if you're not getting the emotional support and you don't have people to listen to you, you need to find other people. And that's unfortunate because you're depleted and you're not feeling well. So to gather that energy and then to go searching can be very, very difficult. But Elizabeth did it, and she persevered. And if you go to see somebody and after 2 or 3 times you're not feeling like they're listening to you, that's enough of an interview moment to politely say to yourself, okay, this person's not it for me. And it takes a while, unfortunately, sometimes to find the right combination of the right practitioner to help you on your healing journey. But I really believe that we're all being guided. And if you just keep connected to that little part of yourself, that little voice that says, I deserve to recover and be well, and I can, and I want to, he or she, the right practitioner, will show up. And I'm more of a belief that women should be treated by women. That's mine, not to disparage male practitioners at all, but I work with women mostly in my practice. And so we have to have a more feminine approach to our life and our healing.
Yeah, I agree. For myself, because I feel that women understand my situation more. They went through miscarriage. They have child, so they understand your body. So I guess, that's a good approach. Liz, do you want to add something?
I feel like I've said, the encouragement that I wanted to share with people, just to keep trying. And there are tons of people out there who want to help you and are equipped to help you. So just keep searching for them.
Yeah, thank you so much for being here. We really enjoyed this talk. That was, by accident you come together. And I always welcome accidents, because
there are no accidents. There
is no accidents, right? Because I thought, at the same time Carol had this timing, and then Liz. So it was a great topic, talking about the real story and then go through this together. Thank you so much. And I
Liz,
hope
it was lovely to meet you
again. Yes.
Yeah, it was great to meet you too. Thank you so much for letting me share my story and having me on. This has been really great.
Just want to add something. Please go and grab our book. My book, PTSD Compass. It's about how to recover from PTSD, grief, miscarriage, or domestic violence and abusive relationship. And also we have some story about first responders, because I know first responders is so much fight and flight mode. So thank you so much for being here. I see you later. Please subscribe to Pontal Calhoun Transition channel to get the latest interviews, and order my book PTSD Compass through Amazon. How to confront PTSD and navigate trauma to triumph.